Okay, there we go. All right, so I am interviewing my friend Robyn Stoddard. She is in her house in Atlanta, and she just got off work. Did you work today, Robyn?
Yes.
Yeah, so she just got off of work, so it's a Friday night, and she's spending her time talking to us. She's going to answer some questions about Ebola because she's the microbiologist who works at the CDC, who we sent all of our questions to. So the first thing I'm going to ask Robyn to do is just talk about her background in terms of her schooling and how she got the job at the CDC. Is that cool?
Sure. So I always wanted to be a marine biologist. So I ended up going to UC Santa Cruz and I studied marine mammals. And then at some point I decided that I wanted to still do research on animals, but I felt going to veterinary school would help my understanding of animals and animal systems and diseases. And so I applied to UC Davis and I ended up going there to do veterinary school.
And we
But
were
I
there
also,
together for a short amount of time, right? Weren't we there
no,
together?
I didn't go there till
Oh,
1996.
okay.
Yeah. So, and I also applied to do a PhD in microbiology. So I was doing vet school and a PhD in microbiology. Still working on marine mammals. I did a lot of marine mammal research with northern elephant seals, and I got to work at Año Nuevo near Santa Cruz. But at some point you have to get a job. So I was trying to stay at UC Davis to be faculty member, but there wasn't a job, so I was applying for various jobs for after graduate school and ended up applying for this job at CDC as a postdoc, which had no plans on doing. So I applied and I got an interview. So they flew me out and I interviewed and they ended up offering me a position. So I took it, not expecting to stay there. I thought I'd end up going back to UC Davis, but I ended up really loving it and I'm learning a lot and I get to do a lot of things I wouldn't get to do working anywhere else.
And how
Like
long have you been there now?
I've been at CDC since 2006.
Okay, so that's a good amount of time. And
Yeah,
you've
and I
traveled
love the
where
travel.
through work?
Huh?
Where are all the places you've gotten to travel through work?
Through work, I've gone to India, Thailand, Belgium, England, Uganda 4 times,
Wow.
Ecuador, Brazil,
And that's
and then
part of your appeal of the job. You like that part, right?
I love traveling. Yeah, not everybody I work with likes traveling, but I'm actually leaving in 3 weeks to go to Bangladesh. And then I think 2 weeks after that, I'm going to end up going to Sierra Leone to go back for the outbreak response.
So talk about like what your responsibilities were when you last went to West Africa. What was your job when you went there? Because a lot of kids were asking about whether you were treating patients.
So when I went, I was trying to go to work in the laboratory because there is a CDC laboratory in Sierra Leone. Because that's what I do. I work in the laboratory, but they had already staffed the lab in the time period I had available. So they asked me if I would go deploy with the epidemiology team to Liberia. So I said I would, and it ended up being that there's sort of a laboratory epidemiology interface, and there wasn't really anybody who was sort of working at the national level, organizing the laboratory
Hmm.
work going on, and then also kind of linking laboratory and epidemiology. So it'd be like case data with patient data with laboratory results. And then there's basic issues with like it's hard to get like samples if you take a blood sample from a patient. There's really no way to get a blood sample from remote Liberia to one of the laboratories.
Wow.
Um, they lack roads. A lot of places there's not even roads, or they're dirt roads. I know one guy went out to go do education in a community about Ebola, and the bridge got washed out, so they couldn't get back, and he sat there for 5 hours while they built a bridge using trees, cut down trees.
Right there.
So, huh?
At that moment, they built the bridge.
Yeah, he sat there and watched them build a
Wow.
bridge with trees. So that was another thing I was working on, is trying to build like a specimen transport system. And then I got to go out with the Army, which I talk about in my blog, for they were going to build some remote laboratories. So I got to go out with them to do site visits to determine where they were going to put laboratories. So just an overall laboratory coordinator at the national level in Liberia.
So, one of the questions that was asked by, or somebody said, um, you had said that it wasn't difficult for you to volunteer, and somebody asked you why. Like, why did you not hesitate? You know, did you feel like it was part of your responsibility, or were you just intrigued, or you weren't afraid of getting sick, or?
So I volunteered, and I felt like this is probably one of the biggest public health events that will ever happen in my career. Hopefully, there won't be anything like this again. And I just felt that it was an opportunity to do what we do best and to go help in this place that they really do need help. Um, and it was just an experience that I really wanted to go be involved with. Definitely, as it got closer, I got more and more scared, because it is Ebola and it's kind of not a very pleasant disease.
Did you have to
Um,
go through any kind of training at the CDC before you left?
we had to do a lot of pre-deployment trainings, about safety, and we
Mm.
talking about Ebola. We had to do some trainings on protective gear, which I didn't have to do since I wear that stuff normally. But CDC's mission really isn't there was a question about patient care.
Yeah.
Our mission is if you go somewhere where you have to put on protective gear, you're not doing what you're supposed to be doing. We're not supposed to be involved directly with patient care. So I definitely, once I got there, I realized it you still have to be careful, but it's not like you're going to just all of a sudden get Ebola just because you're there.
Well, that was that question that Michael asked too about was it hard to keep your distance away from others? Like, I remember reading on your blog, just like standing, you were in one area that was super crowded, like when you were
Yeah,
being brought in.
we got there at the airport. I mean, it was like all of these people in this tiny room trying to get our luggage. So you kind of, you get there and you're not supposed to touch people and you're supposed to be careful. You can kind of tell the people that are new because when you meet them, they're like, "Hi, I'm so and so," and they put their hand out to shake your hand, and you're like, "You must be new." You do adapt quickly, but it still is weird, and because it is such a hard situation being there, and it can be pretty emotional, it's hard not to be able to hug people. And you also just, I don't think until I was in that situation, you don't realize how much you actually touch people, even if it's just like casual contact. If you're somewhere like at a restaurant and somebody hands you something, like you don't realize how often you touch another person. So you become a lot more cognizant of that. And I think coming back to the United States, it pretty quickly I adapted to like hugging people and shaking hands. But even still, I notice when I casually make contact with people because it's the people that you don't know in the community that you're going to be more likely to get it from.
So while
And
you were,
definitely,
go ahead.
go ahead.
I was gonna say, while you were there, were you doing temperature readings constantly on yourself? And
We weren't required at the time. I don't know if that's changed. We weren't required to, but I still did. And there was, one day where I did spike a
yeah,
fever, so I had to stay in my room. And I was, even though I knew I hadn't had an exposure to Ebola, it's hard not to get scared.
yeah, paranoid.
But nobody from CDC has gotten Ebola. There have been hundreds of people that have gone there, and nobody has gotten Ebola. But if we did, like, they would take care of us. I mean, they would fly us back to Atlanta, and we would go to Emory.
And did you get quarantined when you came back?
No, in Georgia, there's no quarantine. I just had to report my temperature twice a day to CDC and Georgia Public Health.
For how long?
Places where they are doing quarantine.
How long did you have to report your temperature to them after you came back?
21 days.
So it was 21 days, the same 21 days. Huh.
Yeah. So just a little thing you could do with the students is ask them for maybe like a certain amount of time, I don't know, half a day or something. Don't touch anybody and see what it's like. Or the other way you could do it is like do a hashtag every time you touch a person. And you can just see, like, you just don't realize how much you touch people until you can't.
Yeah. And then the one question that kids were asking about how it spread through body fluids, you were trying to, you were saying that was kind of a complex question.
Yeah. Well, and the other thing too to bring up about not touching people is that's really a problem with kids.
Yeah.
Because kids, I mean,
everything. They put everything in their mouths.
They get into everything.
Yeah.
They put things in their mouths. It's going to be really hard to get kids not to touch things. So that can be a big problem. The question with spreading through bodily fluids, I'll get my notes out.
Yeah.
So how it spread quickly, are you talking about that question?
Yeah. Because
Um,
that's why they don't want you to touch anyone, right? Is that, I mean,
yeah, so there are many. So the reasons why it spread so much there is because they've never had Ebola in West Africa.
right.
So, in East Africa, they do have outbreaks and people do understand what Ebola is. In West Africa, they never had Ebola. And so people didn't necessarily believe it. They thought, and then all these foreigners came in and were telling them, and so they didn't trust people. They thought that they were lying to them. Um, and initially, it was a lot of denial where people would get sick and they would hide the cases, which
Right.
meant it would spread more. So that was one of the things.
Culturally,
Usually,
right.
yeah, culturally. And then in East Africa, the outbreaks generally happen in really remote locations. So there's nowhere for it to spread. But in West Africa, they were in remote locations, but then people came back to the large cities,
Hmm.
and there's slums where very high density populations, and you can have like 15 people living in one room. And so it just spread. That was another way. Like we were talking about earlier, another thing is, traditions there. They have these burial traditions where it's very sacred that they go through these traditions when they're burying their loved ones to prepare them for the afterlife and meeting their relatives. And part of that is cleaning the body and making sure that they're clean and wrapped in clean clothes. So, and then they also will kiss dead bodies.
Yeah, we saw the
So,
picture that you took off of the TV of the advertisements and
yeah,
that said no kissing.
no
Yeah.
kissing, yeah. So they'll wash the bodies and kiss them. And it's like a multi-day process. So when people die of Ebola, I mean, they're going to, because of, vomiting and diarrhea, they'll probably have a lot of Ebola on their body. And so
Right.
then you have these people just touching them and getting exposed. So you can just have whole families end up getting Ebola because of their burial practices.
And you said that
Um,
there were a lot of kids who were orphaned, right? Because whole families would die.
yeah, yeah, a lot of kids were orphaned, or I know that I heard about this one woman who her husband and her 3-year-old or 3-month old baby died and
Oh,
she was left behind. And, it's pretty sad. I know there's probably, I think I've heard there's thousands of orphans. And a lot of times with adults and kids, like once they've had Ebola or they were related to somebody who have Ebola, they're shunned from the communities.
hmm.
So, they have nowhere to go. Some people, if they had Ebola, when they come back to their community, their house has been looted or burned down, so they have nowhere to go. Some communities, they're very welcoming, and part of that is the
I was going
education
to say it's all
process.
about education, right?
So there's been a lot of a lot of trying to go out and do social mobilization and education in the communities. And I think as people, initially people are in denial and they don't believe it and they hide cases, but then when everybody starts dying, then they realize what's going on. And so then people are trying to stop it so you get less spread, but then that means if their relative gets sick, that they're shunning them, and it stops them from getting Ebola, but they're basically taking the sick person and saying, go away, I don't want you here.
Yeah,
So it
that's
can be kind of sad.
very sad. Okay, so my screencast is gonna stop in about a minute and a half, and I know we're not nearly done. So,
Yeah.
would you be cool with me doing a second recording?
Yeah.
Is that okay? Okay, so I'm gonna stop right now, and then I'm not gonna turn off Skype, but I'm gonna stop the recording, and then I'm gonna
Okay.
restart it.
Okay.
Okay.